Well, welcome everybody. We are very excited to have you with us today. We have some great speakers and some great content to pass on to you. And to kick us off, I wanted to welcome Dr. Heidi Overton. She is originally from New Mexico and currently serves as the director of the Center for Healthy America for the think tank AFPI in Washington, D.C. Overton served as a White House Fellow in 2019 to 2020 in both the Office of American Innovation and the Domestic Policy Council, and is finishing her medical training in preventative medicine. Previously, Dr. Overton was a general surgery resident at the Johns Hopkins University School of Medicine. She received her MD from the University of New Mexico School of Medicine and her PhD from the Johns Hopkins University Bloomberg School of Public Health. That's a mouthful. But we are very happy to actually have her as a board member for the Health Reformers Academy. And with that, Heidi, why don't you kick our time off today? Thanks.
Great. Thank you, Josh. It's so great to be with all of you. The Health Reformers Academy is something I'm very passionate about because I think that we need more formal training for folks. I'll tell you my story of how I got involved in health policy and kind of made the transition from what I thought was going to be an academic surgery career into the health policy and public policy space, and why it's so important. You know, health is the great equalizer. It doesn't matter your background, where you're from. When you're sick or your family member's sick, you just want people to get better. And going through undergrad and medical school, I had amazing experiences at the University of New Mexico, and I got to see a lot. I got to serve as a board member of the university, which governed the hospital, and started seeing early in my medical career a little bit of discrepancy between boardroom conversations and what was happening in the hospital wards. And that piqued my interest in kind of what happens in the governance structure of healthcare. But it was really at my time at Hopkins where I started seeing the need for some real solutions. So as a surgery resident, you take care of all of the traumas that come in. You take care of some of the most advanced cancer cases in the country. It's the best place in a lot of ways the world to get treated for pancreatic cancer surgery, which was where I was headed. But as I started learning that and seeing and meeting these amazing people, I also started working with Dr. Marty McCary on issues like price transparency and realizing that there were patients that were getting their wages garnished for unpaid medical bills, sometimes at much higher rates by certain hospitals than at others. And so we started an advocacy group called Restoring Medicine during that time. And it was very eye-opening because I realized that I had been trained to save a life, which is an amazing privilege, but I didn't know and I didn't realize as part of my medical training that in doing so, many patients faced really harsh financial consequences and didn't really have advocates to speak on their behalf. And so really showed me what parts of the healthcare system were broken. And so was privileged through the White House Fellowship to get to jump in to the highest levels of health policy, and decided after the COVID pandemic to transition away from surgery into preventive medicine and to continue in the public policy space, because I think there's a real need for physicians to have a voice, as well as for anyone that's interested in health policy to know the full spectrum, and that we need every perspective. So as I went through, I got to work with some healthcare entrepreneurs at the White House who are really talented and see healthcare from a different perspective. So one of the ways that I approach health policy and why I'm so excited for your willingness to join here and for the agenda that's laid out today is that you're going to get to see how health policy is impacted from a variety of different perspectives, from people who are leaders in state government, to economists, to physicians, and really get to see that this is an issue that takes up 1/5 of our economy. And it's also one of the most personal issues to anyone that you meet. And so we need everyone's perspective. We need all voices contributing, and we need to be well trained, just like you go through many years of medical training to take care of patients. I think this program is a way for you to really jump in to intentional training programs to know how to best contribute to health policy and to know what are real solutions. The thing that's exciting is that there are real solutions, and finding good models that work that really do allow us to put patients and doctors back in charge of healthcare. That's one of the core principles that I work on here. And so you're going to hear a lot about that today. We're really excited. And I'm privileged to always get to come and join these. So Josh, thank you for the opportunity.
Well, thank you so much, Heidi. Really appreciate your provider perspective on you are often downstream of policy, which we're going to talk a little bit more about that. So thank you for joining us. So for those of you that don't know me, my name is Josh Archambault, and I'm the president of Health Reformers Academy. And this morning, I'm not going to bury the lead. We want you Actually, no, we need you to help save the American experiment by fixing healthcare. We at Health Reformers Academy believe we can jumpstart someone's career by 5 years as we partner with other groups on the center right to recruit and train the next generation of free market health policy leaders who have to fight for America's healthcare future. Now, you'll hear about this vision that we have and the Health Reformers Academy fellowship opportunities at the end of the day, but this fight matters really for real lives. DeMonte Driver is a 12-year-old young boy that lived in Maryland, and he died of a toothache. You might be asking, how is that even possible? Well, because bacteria from an abscess in his tooth spread to his brain, and because the Medicaid program was so broken, his mother couldn't find a dentist to take Medicaid to perform the simple tooth extraction. When she finally found one, DeMonte ended up spending 6 weeks in the hospital, and following 2 operations, he died. As a father myself, this story is just simply heartbreaking. This is a program that we spend hundreds of billions of dollars on each year that delivers uneven outcomes at best, and at time appears to deliver the same or worse outcomes when compared to those that are uninsured, believe it or not. Yet in America, many fight to put more people onto this program, and many conservatives or libertarians just look the other way because it looks complicated. Or they might think, oh, some private insurance companies are involved through managed care administering the program, so it must be better, right? All while healthcare spending bankrupts our country, siphons trillions of dollars a year from other industries into a seeming black hole, and still routinely delivers uneven health outcomes. The list of what's broken in American healthcare is long. Prices that vary by over 1,000% for the same services, depending on where you park your car that day. Public programs that receive more federal money for able-bodied adults, pitting them against blind and disabled that receive less. Private insurers that seem almost indifferent to the increasing cost of care and have non-innovative plan designs. I could go on and on. Yet on the other side of the coin, we have some of the most remarkable medical research in innovative treatments in the world. 3D printed ears using your own cells, custom designed drugs being tested on your cells first before you receive them internally to maximize outcomes. AI-aided eye diagnostic devices that can be run by almost anybody with a basic education to determine with near certainty those that are at risk of going blind. Wearable robots to help those that have suffered from a stroke. Robot-assisted surgery that will allow an operation on a beating heart without opening the chest. The list of what is good or promising in healthcare is long. We will all be patients. We all have family or friends that have experienced the healthcare system, both the good and the bad. And yet healthcare policy is often upstream impacting their experience. Policymaking is about trade-offs and can be about winners and losers. Policy can put in place barriers. It can have huge unintended consequences, or it can ensure that any guardrails are kept broad enough to allow a marketplace to emerge with greater competition and market accountability. We have people signed on for the bootcamp today with varying levels of experience and knowledge about health policy. For some, the topics that we covered today may not go deep enough, but for others, they'll be learning the difference between Medicare and Medicaid for the first time. Our hope is you'll lean into that range, expand your network today during the breakout sessions, and you may be able to help somebody in the future and strive to learn a few new things in the process. Healthcare is the single biggest spending item in every single state budget and is driving the vast majority of mandatory federal spending. So even if at first blush, healthcare policy feels a tad intimidating, it should matter to all Americans as it's Pac-Manning every other policy area and growing the influence and power of government. Worse than this growth is that it's cementing in crony capitalism of well-funded, powerful special interests that fight to keep the gravy train flowing while they often undeliver for results. The status quo is granting government bureaucrats far too much power to pick winners and losers. It's not an understatement to say that the economic future of the country is tied to us being able to figure out how to fix healthcare, and it directly impacts our physical health as well. Today, you're going to hear from a few speakers on their why. Why do they care about health policy? Or why do they think conservatives or libertarians should care about this? For me, this is a justice issue. I've spent my entire career seeing special interests fight over their piece of the pie or try to grow it. Enough is enough. It's time to recruit and train the next generation to fight back, to demand transparency and accountability. So thank you for joining us.